Thanks, Audrey, and good morning, everybody. It's great to be here after what we've all been through over the last couple of years, to see everybody in person. So just following on from Brian's talk, and I think some of the themes, I'll be approaching them from a different perspective, but I think there are common themes across both of the presentations this morning. So what I want to do this morning is just touch briefly on some of the challenges that are facing our health system, and I don't think any of them will be a surprise to anyone in the room. And then I'll move on to look at how we can hope to use new technologies to overcome some of these challenges in the future, before really then focusing on what the key enablers are and the key issues that we have to address if we're really going to maximise the benefits that we can hope to gain from these technologies in terms of improving health outcomes. So the first of these challenges, as I said, will come as no surprise to anyone in this room. But the extent and pace of demographic change is really quite startling from the perspective of the Irish healthcare system. Since 2012, we've seen a 400,000 increase in the size of our population, and we're expecting another 500,000 people to be living here by 2035. Over the same time frame, our population aged over 65 years has increased by 35%. And to put that in perspective, we've seen an average increase in the same population of just 16% across Europe. And so Brian referenced this, but what often gets missed in this, and I recognise this in this conversation, is the fantastic success that we've had in Ireland over the past 20 years. At the end of the 1990s, we were ranked 16th across Europe in terms of life expectancy. Today, we have the highest life expectancy across Europe at 83 years. So the challenge for us as we look forward is not alone to increase life expectancy, but to increase healthy life expectancy. And to do that, our health system is going to have to overcome the interrelated challenges of multimorbidity, inequities in access to and outcomes from care, and overcoming and addressing the unsustainable increase in the cost of healthcare provision. And of course, all of that is going to bring additional requirements in terms of our health workforce. But it's coming at precisely the time that the WHO is predicting an 18 million global shortfall in the health workforce by 2030. Now, we know the pandemic has had an enormous impact on healthcare workforce, working in extremely pressurised conditions, and burnout and fatigue are very real issues. Retention and recruitment are key challenges for health systems internationally, and Ireland is no different. We're seeing increasing rates of turnover. We're seeing many employees who were due to retire now retiring. But on top of that, we see the ESRI predicting that in the acute care sector alone, we're going to need up to 32% increase in doctors, nurses, and allied health professionals to 2035. So increasingly, the key question that's going to have to be asked when any new initiative is proposed across our health service or health system is, where is the workforce going to come from to facilitate the implementation of that initiative? Now, to change tack for a second, the next challenge that I feel, you can't stand up and talk about the challenges in health without addressing this today, in my opinion. Traditionally, when we talk about health and climate change, the conversation generally is about the health impacts of climate change on individuals and communities. Historically, we've given much less attention to the climate impact of the health sector itself. And that's despite the fact that we know the health sector has a very significant climate footprint. Indeed, if the health sector were a country, it would be the world's 5th largest emitter of greenhouse gases. It's responsible for more than double the emissions of the aviation sector. A typical hospital consumes more than 3 times the energy of a commercial building of similar size. And just 7 hours of anaesthesia with desflurane is the equivalent of hopping in your car in Dublin and driving to New Delhi and back in terms of its climate impact. And all of this, the increasing size of our population, our rapidly ageing population, the pressures on our workforce, the unsustainable trajectory in terms of costs, the need to address the climate impact of the health sector. All of this is coming at the same time as public expectation is rising. We now live in an available anywhere culture. Whether you're doing your shopping, banking, dating, booking a holiday, you expect, and people are increasingly expecting, an anywhere, anytime, self-directed, personalised, convenient experience. The reality is that Amazon and Netflix and companies like them have come to dominate their industries for one central reason. They have improved the consumer experience. Now, while health has been relatively slow to come to the table on this, it seems clear that people, seeing these developments in all other aspects of their life, are increasingly going to demand these developments when it comes to the health services that they're interacting with. And that goes not just for the people who are using those services, but just as much for the health workforce who are tasked with working within them. So increasingly, health systems are going to have to address the challenges they face as end-to-end user experience problems, and are going to have to adapt to the reality of having to provide multimodal care across a variety of traditional, face-to-face, but also hybrid, virtual, digital platforms. And this brings me to the digital revolution in healthcare that I believe in 10 years' time we'll look back and see has been catalysed and accelerated by the pandemic. The reality is that over the past 20 years, we have seen digitisation of 20th century models of care. However, predicated on the widespread use of digital and virtual technologies, artificial intelligence, machine learning, automation, robotics, genomics, precision medicine. All of this means that over the coming years, we're going to see increasingly the development of entirely new models of care and ways of working that will be premised on a digital-first approach. Now, I know what everyone in the room is thinking. You're thinking that sitting here in Ireland, all of this seems remarkably far away from where we are today. But the reality is that all of the world's major technology companies are now expanding their reach into healthcare, either through mobile phone-based patient records, through artificial intelligence for health programs, through sensors, through wearables, through digital assistants. The FDA in the United States has seen a year-on-year increase in approved AI for health applications, and the market for artificial intelligence in health is expected to grow from less than 4 billion in 2019 to over 40 billion by 2026. And we're going to see the same increases across a whole range of different technologies. The European Union too has recognised the need to harness technologies to overcome the challenges that we're facing across health systems. In one of their most ambitious projects to date, a European health data space will be established by 2025. And as part of this, it's expected that all European citizens will have access to their medical records by 2030. So it seems clear to me that if we're going to overcome the challenges we're facing, both in Ireland and internationally in relation to healthcare provision, then we're going to have to address and utilise the technologies that are there to best effect. But the gap between the promise of these technologies and the reality remains very substantial, particularly in Ireland. And so, from my perspective, I think one of the key reasons for this is that we've spent too much time focusing on the bright, shiny technologies themselves and not enough on the key enablers that need to be in place if we're to make maximum use of these technologies. And so I want to talk briefly about 7 of these enablers today. The first is that when it comes to considering what new technologies we're going to adopt or fund or implement, we need to take a population-based, person-centred approach. And what I mean by that is that when we're considering which technologies to adopt, we need to ensure that those technologies will first and foremost tackle disparities in access to and outcomes from healthcare provision. That they'll enable us to move away from once-off, transactional, condition-specific approaches to care, and instead help us to increase our focus on prevention, on medication management, on early identification and treatment, on self-management support, on secondary prevention. Secondly, with the increasing use of artificial intelligence for health, with all of these new digital technologies, with the blurring of the lines about what does and does not constitute a medical device, with the increasing and widening role of consumer tech companies in healthcare, all of these issues raise significant privacy and ethical challenges. So when it comes to planning, implementing and evaluating digital interventions, we're going to have to take an ethics by design mindset, which means addressing these issues upfront rather than waiting to have to address them down the line when they've become a problem. The third issue or enabler that we need to focus on is the issue of risk and patient safety, issues which are now completely intertwined with the topic of digital transformation. And that's from two perspectives. First of all, we can use these technologies as we go forward to improve patient safety. But just as importantly, if not more importantly, is that we need to have mechanisms in place to ensure that these new technologies are intrinsically safe themselves and are not increasing the risk either to the workforce or to the patients that we serve. We're going to require significant advancements in terms of our regulatory environment, our regulatory standards, and our guidance and training around digital risk and safety. The fourth relates to digital skills. So we all now live in a digital world, as I've explained, but the reality is that our individual experiences of that world and the risks and opportunities that it brings for each of us varies enormously from person to person. The reality is that there's many people in Ireland today who don't have the knowledge or skills to utilise these technologies to improve their health. And we need to be really careful that we don't deepen a digital divide between those who can use the technologies to improve their health and those who struggle to overcome the barriers to getting online. And that issue extends just as much to our workforce. There are now 5 different generations working in our health workforce in Ireland today, and each has a different set of requirements and skill sets when it comes to using digital technologies. The reality is that the vast majority of our workforce are self-taught in the use of these technologies. And so workforce planning is increasingly going to have to focus and pay attention to the digital-first models of care that will define health systems of the future. And digital skills are going to have to become a core component of education and training for our current and future workforce, as will be the case in France from next September, when it will be mandatory for all undergraduate healthcare professional students to have digital skills training as part of their curriculum. Now, moving on to the issue of data. And one of the key challenges we faced, particularly in the early stages of the pandemic, was a difficulty of understanding what was happening with the virus and its consequences because of disconnected and inefficient use of data. We all want Sláintecare to succeed, but the reality is that if we're to achieve what's set out in Sláintecare, to get the right care in the right place at the right time, then people and the workforce serving them are going to have the right information in the right place at the right time. This is going to require this health system and health systems internationally to change, to revolve around the individual. And at the core of that is going to have to be a central principle that people have a right to access their own health records and have a say over how their data is used, both from the perspective of their own healthcare, but just as much from the perspective of population and service planning for innovation and research. To do this, we're going to have to develop a secure, robust infrastructure, which has data liquidity and interoperability by default. And essentially what that means is we're going to have to develop a data infrastructure which allows data to flow seamlessly between the different systems that we have across our health sector. And ultimately what we need is that will facilitate bottom-up local innovation and data exchange whilst maintaining top-down standardisation of approach. And of course we're going to need to spend. This is not going to come cheap. The reality is that we need to invest in the foundation stones of our digital architecture. If we want to have the systems of insight that we all desire, if we want to achieve the efficiencies that we require to make our health system sustainable, there's no way out of this other than spending. And when we do spend and invest, that investment is going to have to be aligned with the strategic health priorities of the country. It's going to have to come with long-term commitment to digital transformation. And we're going to have to be sure that what we implement is right for our system, the messy complexity of the Irish healthcare system and the digital maturity of our system as it stands today, as opposed to some idyllic system internationally. But ultimately, even if we do spend, the success of any digital transformation will be predicated on whether those for whom that transformation is intended are willing to adopt the new technologies. And ultimately, that comes to the issue of trust. And one of the key learnings from the pandemic was that trust is at the core of mobilising change in healthcare. Health and healthcare, first and foremost, is about people. And if people, the public, service users, our workforce and healthcare professionals serving them. If people don't trust what's being proposed to be implemented, then we're not going to have a successful digital transformation. And in order to get that trust, we're going to have to prepare people for uncertainty, because digital transformation is going to bring uncertainty, it's going to bring change, and we need to take the time to prepare our people for that. We need to be really honest, as with any other initiative in the health system, that there's no one panacea. There's no one technological solution which is the panacea to all our ills. We will have failures along the way. Progress will be incremental. But there also needs to be commitment that we will spend and sustain and scale what's working well. We need to be clear that there'll be value assessment, both from the perspective of budget impact, but just as much from the perspective of clinical impact and outcomes for people and cost effectiveness over time. We need to recognise also that whilst technology brings great promise, it also has limitations. And ultimately, any new technological implementation should be about augmenting rather than replacing what's currently working well in the system. And then finally, there needs to be recognition too that not all innovation is about technology, and that there are people and teams all across our health system today who are innovating and coming up with novel solutions to complex problems in the absence of these new technologies. So there are some of the challenges that we're facing and some of the ways in which we can use technology and the enablers that we're going to have to address if we're going to overcome some of those challenges in the years to come. But given the challenges we're facing, over the next decade, many elements of healthcare in Ireland will have to be delivered in ways that are fundamentally different from those of the last half century. A successful digital transformation in Ireland will have to amount to a system-wide reorganisation of our health system. And that's going to require very significant levels of leadership and commitment to change. Because ultimately, whilst the data explosion and the technological innovation that I've discussed today holds great promise in terms of helping us to move away from episodic, siloed care models that we're all used to today, and instead it gives us an opportunity to reimagine and reinvent care in Ireland as something that can be personalised, integrated, and a person-centred health experience. We can only achieve that if we collectively shift our mindsets, if we harness the extraordinary levels of interdisciplinary, intersectoral and interagency collaboration that we've seen, that we can achieve as we've seen over the past 2 years, and collectively use all of the people, resources and technologies that are available to us in Ireland to improve health outcomes for all. Thank you very much.